And greetings. Thank you so much for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I have a very important show for you, and this is with a guest who is right in your area. If you're listening on Long Island, I know we have people listening literally everywhere in the country and everywhere in the world because you can listen on iHeartRadio. But especially for your local people, this show is for you, because we have a wonderful holistic dentist, which is not an easy thing to find. People are always calling me looking for holistic health providers, and you are going to be very impressed when you meet our guest today, Dr. Olga Isaeva, and we just call her Dr. Olga. She graduated from Louisiana State University School of Dentistry, and then she rediscovered her passion for dentistry in the newly emerging holistic field of biomimetic dentistry, and we'll let her tell you what that means. Dr. Olga is also a graduate of the Alan Mandela Perry Center for Biomimetic Dentistry and is one of a handful of dentists, they're hard to find, who believe in nature-driven dentistry. She is strongly committed to conservation and preservation of the tooth structure versus doing things like crowns and root canals, and she'll tell us why. The best way to find Dr. Olga is at her center, which we'll also let her tell you about. You can find it at the Nature's Dental. So thank you so much for joining us today, Dr. Olga.
Hi, Elaine. Thank you so much for having me.
Now, I forgot to mention something which is important, because you also are very grounded in Reiki healing and energy medicine.
Yes. I got into Reiki mainly for self-healing, and I'm a Reiki 2 healer. And I like to incorporate that into my dentistry if the patient requests. But I'm sure Reiki is always flowing, as you know. We have to be connected constantly to the higher source.
Now, when you started your life's work many years ago, you entered dental school here in the United States.
Right.
What made you want to be a dentist in the first place?
Well, I come from a family of physicians, and that was kind of on the back of my mind. I always played with little instruments and little tools when I was little and trying to fix people's and balls. So as I got older and we moved to the U.S., I got interested in dentistry. Mainly, I had some bad teeth myself, so I went to observe a couple of times to the dental office, and I was impressed. So that was a very easy decision for me, and I never regret it.
So you went through training as a dentist, but of course, in your training, I doubt if, and maybe I'm wrong, if they incorporated many things that you focus on now at Nature's Dental.
Right. So as a general dentist, right, I've been practicing for about 10 years. And what's a little personal story, I had some amalgams placed when I did move to U.S. And I ended up with some 3 root canals in the crown down the road as I replaced them with the white fillings. So for 10 years I've been practicing. I got a little disappointed with the dentistry that I was doing and the dentistry that happened in my mouth. And in the search of a better way for myself and for my patients, I started looking into holistic ways and alternative and what exactly all that means. So this is exactly when in 2013 I came across the term biomimetic, and reading one of the articles of Dr. Alex Schwartzman. You actually had him on your show a couple of times as well. And this is when literally the light bulb went on in my head, and I'm like, oh my God, literally jumping up and down and saying, this is exactly what I always wanted to do. I just had no idea how to do it. because we're not being taught that. So within the day, I was able to track down the school, the continuing education school that teaches trained dentists to practice this type of way, and it's called biomimetics.
So that is so exciting. Now, you and I have been talking, and I know that you know that I know some of the words you've said, but I want you to verify them for the listeners. And first of all, I will just remind them that everyone, that you're listening to Herbal Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse. And my guest today is Dr. Olga. She is a holistic dentist. And the best thing to write down right now so you can find her later is Natures, with an S, dental.net. naturesdental.net, and she is very easy to get to. It's a little past Huntington. What town exactly is your office in?
So yes, we're located in Green Lawn.
Okay.
So that is part of Huntington.
Right. It's easy.
It's very easy. It's I work with two other colleagues, Dr. Chitwan Gupta, who graduated from dental school in India, and she rediscovered biomimetic dentistry for herself as well and found home with us. And also Diana Kopach, who got trained and worked alongside with Dr. Alex Schwartzman. So three of us brave ladies practicing green dentistry in Green Lawn. So you can't forget that.
Wow, that is fantastic. You should put that on a banner. I love that.
I just thought of that.
Wow. And last time I was in your office, and I do want to share openly with our listeners that I am also your patient, because I have used holistic dentistry going way back in time with such pioneers who you may be familiar with, and they're getting older now, such as Dr. Jay Durek and Dr. Israel Brenner. So you may, in fact, have heard those names.
Yeah.
And they're not so active anymore. And now you are my dentist, and I'm sharing that openly because you're walking into your office in and of itself is a healing experience. There's beautiful aromatherapy. There are like soothing fountains. It's like a meditative state, which you don't usually encounter in a mainstream dental office just walking in, let alone all the work you do that's different. So that's what I wanted you to share. What is the difference between amalgam fillings and white fillings? You used those terms. What do they mean?
Certainly. So the amalgam fillings would be more like metal fillings. They're 50% filled with amalgam, with the mercury. So it's a blend of metals with mercury in it. And as we're learning now, the toxicity of mercury, this type of dentistry kind of coming more into focus, because this is our main point. We remove a lot of toxic metal fillings, which not only leak mercury, but they literally crack our teeth. And this is what's so sad, and kind of what happened to me in the process of removing them. They're very rigid. As you understand, metal is very rigid. So, and our teeth, believe it or not, are very flexible. They're strong and yet flexible. So this amalgam filling, like, you don't need to be an engineer or a dentist to realize when it's wedged in the middle of the tooth throughout time, and sometimes they've been there for 20, 30 years, they tend to crack our teeth from the inside, and the bacteria gets in and start doing their dirty business, and this is how you can get the cavities underneath those big metal fillings. So the type of dentistry that we practice, the biomimetic approach, is like a total opposite of the mechanical retentive dentistry, but it's more like an advanced adhesive dentistry. That's the best way to think of it. So it's sort of like a super glue space age technology, where we're able to use the white composite material and layer it in a way that would mimic the dentin part of the tooth, which is very flexible, and layer in a different way that will mimic the enamel part of the tooth, which is on the outside of the layer of the tooth. And the densities of those materials, honestly, are literally mimicking the density of the dentin and enamel, respectively. So this is huge. Once I learned that, I would not want any other dentistry in my mouth. So this is really where I think the future of dentistry is going. And we are right there at the front lines.
Okay, and now how many dentists are getting involved in this other thought form of more natural interventions, which seem to make so much more sense on an evidence-based level?
Correct, and it is very, it is another way of calling it a common sense dentistry because it's really easy to explain.
Oh, wait a minute, common sense dentistry. Boy, you're full of great little slogans here. The green women dentists of Greenlawn practice common sense dentistry. That is fantastic.
Thank you, Eileen. So what I was going with this, yes, the common sense dentistry, it's... there are dentists interested in it, definitely. Each year, our numbers are growing. Not as much, for some reason, on the East Coast. It is more prevailing on the West Coast in Europe. Some of the European countries like Switzerland and Japan are totally switching the way they're teaching dentistry. So the dentists that graduate from there are not doing any more crowns. Can you believe that? And this is where it's all going, but the East Coast is a little behind with a lot of alternative medicine and dentistry as well. So we can always, anyone can always visit the Academy of Biomedical Dentistry to look up the dentists in their area. I know on Long Island there is at least maybe 5 of us. There are some in New York City as well. But again, it is more prevailing on the West Coast at this point.
Yes, so that's the way things usually go, right? You know, the natural progression of development seems to be from the West Coast to the East Coast. But nonetheless, you're right there on Long Island. Now, what about things like ozone? Is that something you use in your office?
Yes, so we also utilize ozone, so that's separate from the biomedical approach, which obviously could be combined, but when I did learn all these natural modalities, I figured it's just no-brainer to connect them all under one roof because it's all more natural, and the ozone is just 3 oxygens together, so it's highly disinfectant. So instead of chloride, it's actually more potent than chloride, 1 drop of it. So we use that to put the ozonated water throughout all our units that we use water. So any tin pieces or whenever you get dental cleaning, instead of regular tap water, there's ozonated water that's going through the cavitron, all the syringes, air water syringes, as well as we use ozone gas to sort of infiltrate the pockets. If you have any periodontal disease, if you have bleeding gums, it does help with oxygenating the tissue. And we also use ozonated oils, which anyone can get and floss and brush with it, which work the same way, helping natural disinfection of the mouth.
And welcome back to more right here on Herbally Yours. Thank you so much for joining us. This is Ellen Kamai, the Natural Nurse. You can find me at naturalnurse.com, and you are listening to Herbally Yours. And we're here talking to natural dentist and energy healer, Dr. Olga Isaeva. And I'm not sure how we say your last name there, Dr. Olga, but I just call you Dr. Olga. How do you say it?
Sure. So the last name pronounced as Isaeva.
But either way, I notice all your doctors and even your nurses and the people in your office staff, everyone calls you Dr. Olga.
Correct.
And of course, you can be found at naturesdental.net. And you were so packed and busy. It used to take months to get into your office, but now you've expanded and you have other dentists working there, so that must make the services more accessible.
Correct, yes. We were booked a few months out, so it was really difficult for me physically to keep up, so it was very important to find someone who's sharing the same philosophy, and as you mentioned, it is hard. So when the 2 dentists reached out to me who share the same beliefs and just as passionate about, saving teeth naturally, not removing any unnecessary tooth structure, and making such a difference in people's lives, because if you think about it, just doing the small restoration the right way the first time around, we are saving so much time and so much money and so much unnecessary time in the dental chair down the road that you just can't put a price on that. And this is very big when we see children, especially, because sometimes they come through and they already been traumatized, and the same tooth has already been revisited a couple of times, and they only had that tooth for a few years in their mouth. So it's very, it's heartbreaking sometimes, and we try to slowly introduce our ways to the parents, to the children, and we do see a big difference in their subsequent care once they come back, and they're less fearful, and they know we're going to try our best to save their tooth without root canal and all that great stuff.
Let's talk about root canal, because, I've had several root canals in my life, even though I know there's a lot of discussion about them being negative. That's what came up, and I just went through with them. But both the root canals I have now had to be pulled out anyway.
Right. Yeah, it's very unfortunate that I have some root canals, as I mentioned already, as well. And once you get that, it's very hard to reverse it. So the only option is either to remove the tooth and then walk around with no tooth, or have an implant placed, where some people are not comfortable with that either, or have a little denture. So the focus of our practice is prevent that from happening, because as we learn, root canals are toxic, and whatever we can do to prevent that from going south, that will be in the dentist's hands.
Wow. So what about root canal? Why is it, so often recommended? And what is another way to deal with I don't even know what it is. Is it an infection, or what leads them to
there's
suggest
different ways.
A root canal?
Right. There's different reasons why a person may need a root canal. So the ones that happened in my mouth, at least, or the ones that are commonly seen, for example, a crown, a restoration, that's called a crown, or a cap. When we do that, we remove so much unnecessary good tooth structure all around. So 360 degrees, the tooth has to be shaved down. So some of this tooth may have been bad, had decay, but some of it wasn't. So the only reason we're removing it is to accommodate the tooth for this cap. And in my eyes, and in biomimetic vision, this is very aggressive. So this type of aggressive preparation on a live tooth, down the road, scientifically proven, will lead to root canals. And they may happen in a couple of years, they may happen in 5 years, 10 years, but there is a chance that it may happen. So what we want to do is preserve any good tooth structure left. And again, the science shows the more destructive the tooth is, so the bigger the decay is, the more conservative we have to be by preserving anything that's left that's healthy. So that goes against crowns right away, because, like I said, crowns are very aggressive and remove a lot of tooth structure. So, like, the crowns may lead to root canals. Another reason someone may need a root canal if they had a very deep cavity, which, that's why frequent visits every 6 months or often or once a year are very recommended, so we can prevent those things from happening. And what happened to me personally was the big amalgam fillings. They were cracking my teeth. So once the dentist replaced it with white fillings, sometimes those cracks keep propagating if they're not properly sealed and filled, and down the road, few teeth need a root canal as well. So that's another tragic thing, but totally preventable if treated properly and the right way.
The other thing I did, which I'm very sorry that I did, which was a bridge, because I had one tooth, that I don't remember what went on with it, but then now the other two teeth that were fine got ground down to nothing. So they're gone now too.
Right.
And I felt like that was so unnecessary. I don't think I really even understood what was going to go on when I walked into that procedure.
Right. Well, this is very tricky. When you do have a missing tooth, the bridge is obviously one of the options. But like I said, the bridge is And like you mentioned, it's 2 crowns. So there's 2 crowns that needs to be filed down and a fake one in the middle. So that would make a bridge. And if the tooth already had an existing crown, that's great. But if you didn't, that means we just filed 2 good teeth for a new crown. And just in my world, it's a little too aggressive. And another term I thought of, a lot of biomimetic, the traditional dentistry also a lot of times called amputational dentistry, because it's similar to, let's say, if you had a finger that was broken and the doctor, or even 4 fingers, they were gone, and the doctor proposed to remove 1 more finger and make you a really nice prosthesis. So it looks nice, but will it be functional? So that's totally absurd. But in traditional dentistry, that's still a norm. By cutting more tooth structure, we put in a crown over it, and that would be the amputational way of practicing.
So what would you do instead, Dr. Olga?
Instead of a bridge? Well, that's what I was mentioning, Eileen. Biomimetic dentistry deals with preventing tooth structure, preventing dentistry, conservative dentistry. Once you already have a tooth missing, we have to kind of go back to either an implant or a partial. Or if the person does have crowns adjacent to the missing tooth, the bridge is an option.
Well, I just want to remind our listeners that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse, and my guest today is natural dentist Dr. Olga from her beautiful location right in Greenlawn, and you can find her at Natures, with an S, naturesdental.net. So, Dr. Olga, for instance, what I have used for myself now is like these little plastic things in some missing tooth areas that I just snap in and snap out at night.
Right.
No. So, what do you think of those? I mean, they seem to be losing favor in mainstream.
I mean, it's a great option. I think talking about flippers or little partials.
I guess I don't know the name of them, but they're plastic and you snap them in.
Yeah, so they're like little removable prostheses.
Yes.
And it's a great option. I'm not sure some people may not be comfortable with it. You just never can replace your natural teeth, Eileen. And this is why the dentistry that we practice it's so important to preserve anything that you can, because once the loss of tooth occurs, it's very tragic, because it's at this point, we don't know any best way to make it work comfortably and visually aesthetic. And implants, again, are so expensive at this point that, some people may not be able to afford it, which will be a great replacement for a tooth loss.
So you think implants are a good replacement, but there is a large cost. So, yeah, I'm not that comfortable, although they say those posts that they're using a titanium, which does not seem to be that toxic. I am not so comfortable with having that drilled in my jaw.
Yes, and a lot of people are not, either from point of view of metal. I mean, there are ceramic implants that are coming in as well into the market.
Oh, I've never heard of that.
Right. There's also some people are so energy sensitive that they may feel like it will interfere with the meridians, and this is why they may not go for implant as well.
Now, you also offer very simple things, let's say, in your office, like toothpaste and mouthwash. How would they be different than conventional?
So the best way to use things in your mouth and anything that we put in our mouth is something that should be edible. So that's the same goes like for the skin and the mouth. And what we use is the calcium bentonite toothpaste, which we make in the office, and anyone can make their own. You just have to get a good source of calcium bentonite clay, water, and any essential oils of your choice. So we have peppermint, orange, what else do we have? Peppermint chocolate. And kids love that flavor, so we put a little drop of chocolate stevia and sweeten the toothpaste that way. And it's very easy to make. You just pour it up, mix it up, and kids love it. Totally edible. It's safe for pets.
Well,
And,
unfortunately, we're kind of running out of time, but I just want one little statement from you. Do I have time for that? I think I don't. Oh, let's see. How do you feel about fluoride, really quick?
Fluoride. Well, any holistic dentist usually do not recommend fluoride, just because, again, it's a neurotoxin, and it might even calcify our pineal glands and all that bad stuff that kind of prevents our creativity and development of the children's brain. So definitely not a fluoride. We do use ozone instead for disinfecting of the teeth.
Well, thank you so much, Dr. Olga, for all that fantastic information. And I want to give out your phone number to our listeners at your office, which is 631-316-1816. And you can also find Dr. Olga and her wonderful team of green women dentists right in Greenlawn at naturesdental.net.